Chapter 29 Sexual Disorders. According to the Maslow's hierarchy of needs, sex still ranks as the basic physiologic needs, meaning that that need for the sexual desire or the sexual satisfaction needs to be met in order for us to actually go to the top of the pyramid and reach our self actualization. Now, with that being said, it's still appropriate for humans to show sexual expression, but we have to still follow the social customs, norms, and the laws of society. And humans express sexuality through thoughts, attitudes, and behaviors. So, sexuality and its expressions are social in nature. There are some things that are affecting how the influence on sexuality for every person. There's cultures and even religious beliefs, maybe personality, attitudes, beliefs, and even some rituals. They can have like a strong influence on sexuality of a person. And as a matter of fact, now there's a wide range of sexual behaviors that are now considered to be sexually acceptable. If we look at the continuum of sexual responses, we're going to see that in the adaptive response, there's sexual behaviors that respects the rights and wishes of others, where it becomes a maladaptive response if the sexual behavior are harmful to self or others in some manner. And we will talk about those disorders or sexual disorders that actually fall under the maladaptive responses. What is an adaptive sexual behavior? It is an adaptive or healthy sexual response is sexuality that meets all of these following conditions. Two consenting adults. So that means that both parties are actually agreeing to the sexual activity. Satisfying to both. Again, both parties are actually consenting and is satisfied. Not forced or coerced. And then conducted in privacy. Self-awareness and sexuality. One's self-awareness has a strong influence on discussion of sexual issues with clients. Developing an awareness of one's views about sexuality involves the process of defining and clarifying attitudes and values. The caregiver's effectiveness is directly related to levels of personal self-awareness and comfort. Okay, sexuality throughout the life cycle. Expression of one's sexuality begins from birth and ends with death. So, sexuality in childhood, young children are unaware that gender is a permanent attribute. But at around 2 years of age, children actually knows how to label themselves according to their gender needs. That those little girls know that they are female, and those little boys know that they are boys or male. By school age, most children identify with their same gender parent. So, for example, you have a maybe a patient that is 7 year old, right? A school age children, a school age child. They are actually expected to identify with their same gender parent. Meaning, if it's a little boy, they would always want to go with the dad, right? Or if it's a little girl, then they would always want to actually spend time with mom. Okay, that's what it means when they identify with their same gender parent. In general, um, it is usually when the child enters the first or second grade before they realize that their sex is not going to change. Sexuality in adolescence. Adolescents, as they approach their mid-teens, their peers and their family, they expect them to start, exploring those sexual relationships and dating. And an adolescent begins to accept self as a sexual object. They start to experiment socially and becomes even sexually active. Teens have difficulty believing that sex can occur without love, so each boy and girl attachment is seen as a true love. Adolescence is a time of intense searching and learning. They are exploring the world, right? They're exploring relationships. And this is why it's very important for us to be doing those sexual education around this time. When they reach the adolescence, that is when they start to actually experiment socially. And if we are not careful and they are not properly educated, then consequences can happen, like those premarital sex will occur, and the adolescent might even have might even be pregnant with an unplanned pregnancy because of those exploring that they are trying to do. Sexuality in adulthood among adults 25 to 59 years of age, relative monogamy appears to be the norm, meaning, one wife, one husband, right? That is actually the norm in the society. Sexual behaviors during adulthood change to accommodate the situation, and the sexuality patterns of middle aged adults have changed recently. More women in their 30s and 40s are bearing children and beginning their families, and single parenthood now is very common. So we did talk about the monogamy, but what are consequences of having multiple partners, right? And serial relationships. So they said, or research said, that those that have multiple partners have that risk to have that mental instability, even the disease, right? Sexually transmitted infections, unwanted or unplanned pregnancy. Some maybe have a financial problems and even end up as a single parent. Okay, now let's talk about those women that is actually having their babies in the 40s or in the 50s. So these women are actually what we call high risk pregnancy. So when they become pregnant when they are in the 40s or the 50s, there's a potential for abnormalities in the child, higher incidence of miscarriage, and just bad experience and all of those complications that could happen in pregnancy because of the age of the woman. Sexuality in older adulthood, the typical picture of an older adult as an asexual and an uninterested individual is a myth, okay? Older adults can just be as interested in sexual activity as younger adults. The closest intimacy and sharing of sexuality becomes more important than the physical act for most older adults. Sexuality persists throughout life, and although sexual activity may decrease in frequency as one ages, established sexual partners still continue. So think of this as how are you going to apply it when you're actually out there in the field already? For example, you're a nurse that's working in a nursing home, right? Or other facilities where there's like older adults. Um, Sexual activity still is considered to be normal. Okay, this is normal. Like we said, that typical picture of the older adult that they are not interested um, in like sexual relationships and sexual activities is a myth. Okay, so when you're working with older adults, you're working in a nursing home, make sure that we're actually addressing those situations with the patients too. So what if they want to have a relationship with, with their another patient maybe, or someone that they know, and it's their girlfriend or their boyfriend, or maybe a wife and a husband, right? You're the nurse that's taking care of the patients. Make sure that you actually have them actually um, exercise their rights, give them privacy, because like we said, this is still basic needs that they're trying to meet. So if you see that, then you're gonna close the curtain, right? Give the patient their privacy. It's their right to actually be doing, this basic needs. All right. Now that we are talking about older adults, so we know that they have all these medical problems. They would have like comorbidities, right? So that would be the time where it's kind of like time for us to talk to the patients and kind of like open up or educate them with the risk and benefits, because you know comorbidities can actually have an effect with their sexual activities. So our role as nurses, our role as clinicians and caregivers is just to educate, right? These are the benefits and risk. And as long as they understand that, then you've done your duty to the patient. Sexuality throughout the life cycle. Sexuality and disability. Many permanently disabled persons are able to enjoy rich and satisfying sexual lives with some adaptation. Health problems, like I just mentioned, your diabetes and arthritis, cancer treatments, right? Cardiovascular disease, they can affect one's sexuality. So these conditions affect only the expression of sexuality and not one's sexuality itself. Improving quality of life involves changing social attitudes that limit the disabled population. All right. Some terminology that we need to remember. Your heterosexuality are those individuals that express their sexuality with members of the opposite gender. Homosexuality are those that have a preference or desire for the members of one's own gender. Bisexuality are those individuals that are attracted to and engage in sexual activities with members of both genders. Transgender is a terminology for person whose gender identity, gender expression, or behavior does not conform to the sex to which they were assigned at birth. And then your transvestism or cross-dressing is sexual excitement derived from wearing the clothing of the opposite gender. So please remember these terminologies that we just talked about. All right, theories related to psychosocial variations. Your biological theories, they believe, or this theory believe, that those sexual belief and sexual expression actually has something to do with the genetic material, with the genes, right, with the hereditary traits. Psychoanalytical theories, this theory believe that sexual variations are behaviors that have neurotic or psychopathic motivations. And then you have behavioral theories, which they believe that sexual expression is a learned and measurable response. All right, let's talk about disorders. Sexual disorders are those problems that actually impair the functioning of an individual or others who are exposed to that sexual behavior. So, under the sexual dysfunction is a disturbance for the four stages of the sexual response. You have what we call paraphilias. And what is paraphilia? It is a group of sexual variations that depart from society's traditional and acceptable modes of seeking sexual gratifications. Your exhibitionism is an intense, sexually arousing fantasies, urges, or behaviors involving exposure of the individual's genitals to an unsuspecting stranger. And then the voyeurism, this is actually what we call as a peeping Tom. This is a sexual arousal achieved by observing unsuspecting person who is naked in the act of disrobing or engaging in sexual activities. If um, you guys want to look at page 351, which is box 29.2, these are description of your paraphilias. We just touch base the exhibitionism and then your voyeurism. And also, if you can see here, pedophilia. Pedophilia is fondling and or other types of sexual activity with those children that's usually under age 13, and and have not yet developed secondary sex characteristics. And then no, the sexual masochism, which is sexual arousal by receiving pain, and sexual sadism is a sexual arousal by inflicting pain to someone or to another person. Right, so know this box. It's very important, very helpful. Gender identity disorder is when the individual is unhappy with his or her gender. So most of them actually would want to go through the process of transgender, which we did just talk about earlier on, is when the gender actually is not the gender where they were born at, right? So maybe like a little girl or a girl, sorry, a female. She was born as a female, and then they prefer to um, be actually do the transgender and be male. Okay. Sexual addiction is a progressive and chronic addiction characterized by patterns of compulsive sexual behavior despite the negative consequences. I mean, addiction, just the word itself is a very strong word. Addiction means something like they cannot stop, right? Something that they have to do because they're addicted to it, okay? So in this one, it's a sexual addiction, okay? So treatment for sexual problems, it depends on the cause, really. It depends on the cause of the behavior or of the problem, the distressing signs and symptoms, and the type of the disorder. We have behavioral therapies. What we can do is like they go to those therapies, positive reinforcement, right? Aversive therapy, and hormonal drug therapy. Like we said, it really depends on the cause, and hormone plays a big role with the sexuality of a person, right? So if that is a problem, then we have to actually somehow stabilize that hormone levels. So hormonal drug therapy, environmental controls, incarceration. So if the behavior is really bad, then we're going to have to incarcerate the person to actually control. Psychosexual assessment is to be aware of the patient's level of comfort when assessing the sexual functioning. and some nursing process that we have to do. Nursing diagnosis for psychosexual disorder are based on each client's identified problem. And what we do is to assess and then treat, advocate, and education. Like I said, tell them the benefits and the risks of their actions, um, properly assess the patient so that we can properly treat the patient. Education is within the realm of nursing. So, what are the topics that we want to talk about for clients that suffer these sexual disorders? What we want to talk about is number one, the prevention of HIV and AIDS and those sexually transmitted infections. Okay, so talk to them about safe sex, talk to them about the risks of their actions, talk about the benefits of making sure that we are using something to like protect themselves, right? Appropriate methods of preventing unwanted pregnancy, especially for those patients that are still in the adolescent stage. We got to make sure that we are actually talking to them about appropriate methods of preventing unwanted pregnancy. And then we talk to them about various means of sexual expressions. All right, question one. Bill is bisexual and is living with his current boyfriend Patrick, who is homosexual. Both Bill and Patrick continue to visit gay bars and are having sexual relations with other men and women. This is known as what type of relationship? The answer to this is two. This is an open relationship, open coupled relationship. And the keyword is because this is a sexual relations where they are together, however, they are still having that other relationship with other men and women. Question two. William recently has come to terms with the fact that even though he is married, he is gay. He has a number of worries and problems. He regrets his sexual orientation and is often unhappy, depressed, or paranoid. What type of homosexual is William? The answer here is two, dysfunctional homosexual. Question three. The nurse is caring for a client who is diagnosed with a diagnosis of pedophilia. When one is talking about sexual variations that depart from society's traditional and acceptable mode, which term is used? Answer here is one, paraphilia. Question four. In 2002, according to Coleman, Kennedy, and Penley, how many Americans were affected by sexual addiction? Answer here is 4, 20 million. And that is summary of chapter 29, sexual disorders.